Assalamualaikum and good afternoon, everyone. We are from Group 3. Today, we are going to present the rare disease that we have chosen, which is Homocystinuria. So, before we start, let us introduce ourselves first. My name is Nurjana Alia binti Rahman with metric number 203031.
Hi, my name is Mahira Waki binti Shahrin. My matrix number is 2030093.
Hi, my name is Noan Shuhada binti Abdul Razak with matrix number 200993.
Hi, my name is Nur Shazwani binti Kamarul Zaman. My matric number 200597.
Hi, my name is Nur Aini Shuhada binti Abdul Razak and my matrix number is 200 863.
As for the introduction, homocystinuria is a hereditary metabolic disorder involving methionine, a sulfur-containing essential amino acid. It is a rare metabolic condition characterized by an excess of the compound homocysteine in the urine and blood. Homocystinuria is caused by reduced activity of an enzyme known as cystathionine beta synthase, CBS. It is an inherited autosomal recessive trait, which means a child needs to inherit a copy of defective gene from both parents to be affected. Next is a little bit about the history of the first case of this disease. The first case of homocystinuria was reported from Northern Ireland in the year 1960. The patient was a 7-year-old child. The child was mentally retarded with thin and fair hair, pale skin, and flushed cheeks. He had several conditions like spider fingers, dolichostenomelia, pes cavus, a high arch palate, and bilaterally dislocated lenses. At the age of 10 years old, the urine of the patient was found to contain a large quantity of homocysteine, and the urine analysis result for the nitroprusside test were positive. The mutation in the CBS gene causes homocystinuria, which is inherited as autosomal recessive. And finally, the discovery of CBS deficiency as a causative enzymatic deficiency followed shortly thereafter. So that's all for my part. I'll pass to the next presenter.
Now we'll continue with the causes and mechanism. Generally, the major causes is autosomal recessive inheritance, where genetic mutation occur in cystathionine beta synthase gene. This gene is responsible for cystathionine beta synthase enzyme that function on breaking down homocysteine into cysteine. However, due to the mutation, homocysteine level might increase and lead to homocystinuria disease. More than 150 mutations have been detected, and it is depending on the specificity or severity of the mutation, whether this enzyme might not be synthesized at all or having abnormality on its structure or function. Next causes is poor diet. Deficiency of several vitamins such as vitamin B6 and vitamin B12 can interrupt with the metabolic pathway of homocysteine. Firstly, deficiency of vitamin B6 can inhibit the process of breaking down homocysteine into cysteine because this CBS enzyme requires vitamin B6 as a cofactor. Thus, a lack of this vitamin, no breakdown reaction will occur. On a side note, lack of vitamin B12 or folate can affect the activity of methionine synthase, which also can lead to the excess amount of homocysteine in the body. Next, for the mechanism, as homocysteine level increase, there are 4 major parts that get affected by it, which are on the ocular part, vascular part, or specifically on the blood vessel, skeletal part, and lastly on the central nervous system. So consequently, damage on this major part will then lead to the most symptoms of this homocystinuria disease. Firstly, on the ocular part, ocular lens is held by zonular fibers that have high content of cysteine. So when there is low level of cysteine, homocysteine will bind and disrupt the cross-linkage of the fibers and weakening the structure, resulting in lens dislocation. Next, for the vascular part, Accumulation of homocysteine will bind to endothelial cells and cause inflammation. Also, narrow the vessel by the action of pro-inflammatory cytokines. Homocysteine also can bind to platelet and causing their blood to clotting. As for the skeletal part, fibrillin 1 protein is the main structural component that provides a support of elastic microfibers of the bone, cartilage, skin, and ligament. However, binding of homocysteine reduces the crossing formation between these fibers, resulting in weaker or deformed of skeletal tissue. Lastly, high level of homocysteine is toxic to neurons in brain. Hence, it will causing the cells apoptosis to occur and lead to bigger neurological problems. Next, this is the table of summary for the causes and mechanism. More details of eye lens dislocation, vascular effects, skeletal and neurological problems, or overall symptoms will be explained in the next slide by the next presenter. That's all.
Okay, next is sign and symptom. So the symptom will depend on the types of homocystinuria. Usually newborn with homocystinuria often appear normal, but the symptom generally develop during the first year of life. However, some people experience symptoms during adulthood, so this may lead to multisystemic disorder of the connective tissue, muscle, central nervous system, and also cardiovascular system. Okay, one of the signs and symptoms is a family history of homocystinuria, flush across the cheeks, musculoskeletal, which is tall, thin build resembling Marfanoid habitus, fair and thin hair, long limb, high arched feet, knock knees. Next is pectus excavatum, which is a structural deformity of the anterior thoracic wall, in which the sternum and the ribcage are shaped abnormally. Next is pectus carinatum, also called pigeon chest, is a malformation of the chest characterized by the protrusion of the sternum and also ribs. Next is intellectual disability, also known as general learning disability and formerly mental retardation. Next is psychiatric disorder, also called mental disorder or illness that causes significant distress or impairment of the personal functioning. My next point is eye anomalies, which is atomyalentis, which is a displacement or malposition of the eye crescent lines from its normal location. Glaucoma is a group of eye disease which result in damage to the optic nerve and causes vision loss. Next is myopia, optic atrophy, retinal detachment, and also cataracts. My last point is vascular disease, where the homocysteine bind to the endometrium of the blood vessel and activate signaling pathway leading to the release of the pro-inflammatory molecule, resulting in extensive atroma formation at young age, which is an abnormal accumulation of material in the inner layer of the wall of the artery. Lastly, intravascular thrombosis, which is the formation of blood clot inside the blood vessel, obstructing the flow of blood through the circulatory system. That's all.
Okay, now we go to the diagnosis and treatment. For the diagnosis, at first it begins based on upon identification of physical characteristic finding as a symptom. However, it could lead in late diagnosis. So homocystinuria that caused by CDS deficiency should be suspected in newborns by undergo the newborn screening program. Under this program, the screening will identify an elevated mercury level, and also mostly newborn screening will show the pyridoxine, vitamin B6 unresponsive form of homocystinuria due to the CDS deficiency. There are some researchers believe that newborn screening fails to detect many of the infants with the pyridoxine responsive form of the disorder because these infants do not have elevated level of methionine when the newborn screening sample is taken shortly after birth. So for this part, the homocystinuria disease will be detected once the symptom was appeared. Next. So the other series of tests that can be done are the genetic testing to look for one of the genes involved in the disorder, and amino acid screen of the blood and urine to check the excess homocysteine, a high amount of certain amino acid which are homocysteine and methionine in the blood and a high amount of homocysteine in the urine might indicate that the baby suffer with homocystinuria. The other tests are to determine the body response to in consuming methionine, and lastly is a liver biopsy and enzyme assay to check the enzymatic activity. Next. After the diagnosis part is done, the treatment will be given. However, for this disease, treatment are more for preventing and reducing the symptoms shown because of the disease. Individual will be treated to maintain normal or near normal plasma total homocysteine concentration. So, for the first treatment that will given are the vitamin B6 pyridoxine therapy, where the certain amount dose of vitamin B6 will be given that can help lead to lower the plasma homocysteine and methionine concentration. For the second treatment that will be given are the dietary treatment or more to methionine restricted diet. This diet should be continued indefinitely. For the third treatment are folate and B12 supplement. For these two supplements are very important because it helps in optimize the conversion of homocysteine to methionine by methionine synthase. So these two supplements can help in decrease the plasma homocysteine concentration. Lastly is the betaine therapy that will be given to those who those that does not respond well to the pyridoxine therapy and also those that fully compliant with the dietary treatment. This treatment provides an alternative pathway to convert excess homocysteine to the methionine. Although all this treatment will be given, but it is very preferable for the patient to remain on lifelong metabolic diet treatment. Lastly, after the symptom appeared, the specific treatment will be given. That's all for the diagnosis and treatment part.
Okay, for disease-specific research, we choose the article titled Classical Homocystinuria, Is It Safe to Exercise? This article wrote by Thank You and another researchers and was published in early January 2021. So basically, this journal is about CBS deficiency that suffered by people at least in 200,000 to 335,000 people worldwide. So CBS deficiency is a genetic disorder linked to impairment of homocysteine conversion due to severe hyperhomocystinemia in patient's body. So clinical symptoms can be seen such as thromboembolism that relate to this journal is a major cause of early death and morbidity. So in healthy individual, usually physical exercise may result in transition increase in plasma total homocysteine, which this fact raising the possibility that exercise might be detrimental in CBH deficiency people. So therefore, main objective for this research was to determine plasma homocysteine in response to physical exercise in homocystinuria patients. So the researchers reported that this is the first study conducted by them to evaluate exercise safety in CBH patients. Currently, no information record on the effects of acute exercise on total homocysteine levels in CBH deficiency people. So for the results in this research, the researchers observed that exercise did not change significantly total homocysteine concentration in CBH patients and controls, then this result matched by age and gender. And second, one bout of 30-minute exercise was well tolerated and safe in CBH patients. And lastly, that metabolic response to exercise was similar between CBH patients and controls. So the researchers conclude that an acute bout of moderate aerobic exercise was safe and well tolerated in our cohort of CBH patients and had no significant impact on total homocysteine concentrations. But although they got a positive result, as they want, in current clinical management guidelines for CBH patients, there are no recommendations in terms of habitual physical activity and exercise prescription. Thus, no recommendation of physical activity has been prescribed to CBH deficiency patients. So, more studies are needed to understand the long-term effect of exercise as well as different exercise as well as different exercise intensities and modes in CVH patients. So, the researchers hope that future studies can be conducted to confirm exercise safety and tolerance in a larger number of patients, as well as to evaluate the impact of gender, basic responsiveness, genotype, and underlying treatment in total homocysteine response to exercise.
Okay, as a conclusion, homocystinuria can be caused by the mutation in CBS gene that disrupt the function of cystathionine beta synthase, preventing homocysteine from being used properly. It can also be caused by the deficiency of methionine synthase that lowers the concentration of methionine, results in the accumulation of homocysteine. Although no cure exists for homocystinuria, vitamin B therapy can help about half of the people affected by the condition. Patients will need to take vitamin and supplements for the rest of their lives. So this will be the end of our presentation. We have included the references in the next slides. Thank you.